Hi, this is Laura Hickson, and we're going to discuss Chapter 1, the nurse's role in health assessment. Chapter 1, Objectives. Explain how assessment skills are needed. Holistic nursing assessment versus physician or physical medical assessment. Describe how assessment fits in the nursing process, the steps of the nursing process, or ADPI, and describe the step 2 of the nursing process, that analysis piece of the nursing process there. And then the types of nursing assessments: initial and comprehensive, ongoing and partial, focused problem oriented, and emergency. We'll start by identifying what makes a good nurse. Some examples of a good nurse are attention to detail, professional communication, including verbal and nonverbal communication, compassion, patience, strong assessment skills, knowledgeable. This is a most critical situation. Without a knowledgeable assessment skill, it's difficult to collect good data. And the ability to teach clients. Are there any other examples that you might be able to name? A nurse equals a team player, caring, inclusive, dealing with a variety of different backgrounds across the lifespan, and skilled. The American Nurses Association defines nursing as the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human responses, and advocacy in the care of individuals, families, communities, and populations. Assessment is the collection of comprehensive data that's pertinent to the patient's health or situation. Accurate client assessments are needed to make these clinical decisions. And the American Nurses Association is very direct about the expectations in nursing and assessment. The Texas Board of Nursing identifies the scope and standards of practice for the RN as one who collects, prioritizes data systematically, and involves the patient, utilizes evidence-based assessment techniques, synthesizes and documents findings, derives nursing diagnosis, and then formulates the plan of care. They note the comprehensive assessment is the first step and lays the foundation for the nursing process. It is initial and ongoing, extensive collection, analysis, and interpretation of data. The Board of Nursing also notes the nurse must anticipate and recognize changes in patient conditions and determines any needed reassessments. This requires skill just in knowing and paying attention to detail, so you can identify any changes. There are the following scope of practice PDFs. As you are certified with the Board of Nursing and licensed with the Board of Nursing, you will need to know what their expectations are. So nursing over the years has changed. We use critical pathways for diagnosis. Care maps are in the software in your charting systems. There's more and more advanced practice, nurse practitioners and clinical nurse specialists. The preparation expectations are also increasing as we have more diverse populations. Nurses are expected to be able to address patients in a variety of different stages of their health status with a variety of different cultures, backgrounds, genders, and orientation. There is an increased role in technology and informatics, and there's even certifications for nursing informatics if that is something that you're interested in later on. But you will do that as a general practitioner. Utilize technology with your charting systems, accessing different platforms as a bedside nurse. As many have heard, the acuity is increasing, and so your attention to detail and care about your patients can get more challenging as the patient's needs increase as well. And so it's integral to be a part of a multidisciplinary team where we are tapping into the information of experts, and that has become even more essential over the years. The focus of health assessment is the nursing assessment. You're going to collect subjective and objective data to determine the overall level of functioning and then make a professional clinical judgment or nursing diagnosis. In contrast, the physical medical assessment is primarily just physiologic status. So these are different. Your nursing diagnosis is different than the medical diagnosis. We start talking about ADPI, the nursing process. So the A is assessment, collecting subjective and objective data. The D, diagnosis, analyzing the subjective and objective data to make a professional judgment. Planning is P, determining outcome criteria and developing a plan. I is implementation, carrying out the plan. E is evaluation, assessing outcome criteria that have not been met, and then revised plan as needed. The nursing process has arrows to steps that go round and round in a circle, and the accuracy of the next step depends on the preceding step. You have to have an accurate assessment before you can formulate an accurate diagnosis. You have to have an accurate diagnosis before you are able to plan appropriately, and so on and so forth. So making sure that you are gathering the correct information and formulating your plan is very, very important. So with evaluation, we look at the previous steps and focus on the desired outcomes of that patient. But again, these are ongoing processes and the arrows can go both directions. The outcomes may change. Then the nurse has to reassess the steps, collect new data, formulate adjustments to their plan of care, and continue the process. And this could happen all throughout the day as you deal with a problem-focused situation. So there's different types of assessment. The initial comprehensive assessment includes the client's perception of the body parts or systems. We call this review of systems. Past medical history and family history with lifestyle and health practices. And we typically do this on an admission where we're collecting a large amount of data and we have not worked with the patient previously. We're going to gather that information. Now, ongoing or partial assessment occurs after that comprehensive data has been collected. For example, if we're doing a shift assessment, we are just reassessing, doing an ongoing assessment. You're not going to do a complete full assessment again. We're going to do ongoing shift assessment. Some of these things might include assessing the lungs, assessing the heart, assessing the abdomen, doing neurovascular checks. So those things are ongoing and part of your shift assessment. Now, the focused problem-oriented assessment is an assessment about a particular client problem and does not cover areas not related to the problem. For example, if you are assessing the focused problem of pain, then we're just talking about the pain here. So we're doing a cold spa assessment about the pain, talking about the severity of the pain, etc. That is a focused problem-oriented assessment. Now, an emergency assessment is a rapid assessment performed in life-threatening situations. For example, if somebody is having breathing issues or having chest pain, we know ABC is airway, breathing, and circulation. So those are emergent, life-threatening situations. The steps of the health assessment are collecting the subjective data, which we know that's the interviewing, the patient's perceptions, taking their information and disease prevention, what they understand that to be. Collecting their objective data, which is measurable data. Then we're going to validate anything with accuracy, which means that we might ask the patient about a particular finding. And then we're going to document and communicate with the team. So all the team is on the same page and we can make a sound clinical judgment. When we're preparing a patient for assessment, we're always going to look at current data first. What does the record say? This is going to give you information. A lot of times there's at least demographic data. There may be educational level and occupation. And we always have to be very cognizant when we're talking to patients, making sure they're understanding, comprehending, we're validating their understanding with during our assessments. We also want to identify what their background is. What is their history on chronic diseases? So a lot of those things will be found in the patient's record. You would want to know as much as you can about the pathophysiology and the objective tests that have been completed on the patient. What the tests are, what they're for, and what the results are for that patient, if at all possible. Now, you are not going to provide a prognosis for the patient. That is not in your scope of practice, but you need to understand what the test is, why the patient is having the test, etc. We're always going to avoid premature judgments. We're not going to make any assumptions. Some people have asymptomatic presentations of diagnosis. Some people who may be very, very sick have no pain at all. And maybe that might not make sense to you. But so we are going to be as unbiased about any diagnosis and when we're doing assessments. There are a lot of times patients will have chronic diseases, maybe history of drug and alcohol use or smoking, lifestyle choices, obesity, and we don't want to make any judgments about somebody's lifestyle choices. We're going to take care of the patient as they are right in front of us. You're going to gather supplies for whatever assessments that you're going to accomplish. For example, if you're going to inspect skin, you may need to make sure you have some type of light. If you are going to listen or auscultate lung sounds, you want to make sure you have your stethoscope and alcohol pads, etc. Be aware that there are some other affecting factors when you're providing an assessment. For example, a patient's culture, maybe family history, the community where they're from, spirituality. People bring their past experiences to the communication situation when you're providing an assessment. So we don't want to make any assumptions, but be very understanding and really listen to your patient when you're dealing in those situations. So again, your collection of subjective data includes biographical information, their history of present health concern, their review of systems, their personal health history, their family history, and then health and lifestyle practices. The objective data might possibly include the results of objective tests, their physical characteristics, their vital signs, appearance, behavior measurements. Any laboratory or diagnostic testing obviously is measurable, and results of those assessment findings again. The subjective versus objective data. So subjective is data that's elicited and verified by the client. Or can be obtained from the client record or other professionals. Now, the skills needed to get this subjective data is an effective communication, empathy, and good listening. When you ask a patient questions, you have to give them time to answer, and that requires a good listener. An example of a subjective data would be a quote unquote your patient saying, "I have a headache." That is data that's elicited from the client. The objective data is a measurement, direct or indirect, from nurses or others, like vital signs, a daily weight, etc. These are observations, assessment findings of nurses and providers. So some of the skills from an objective data collection would be inspection, palpation, percussion, or auscultation. Now, some examples of objective data as well are vital signs, a pulse, or an x-ray. Now, in the nursing process, the step 2 is analysis. And in order to perform an analysis, you have to be able to identify abnormal data and strengths. In order to be able to complete this analysis, you have to be able to get this information from your assessment. You're going to take your assessment information, cluster that information, and then you're going to draw inferences and identify any issues. Now, from that data, you're going to analyze and propose possible nursing diagnosis. So then we check for any defining characteristics of the diagnosis and maybe rule some of them out because we will want to prioritize a nursing diagnosis. At the very end, you are going to document your conclusion. But it all starts in your assessment and analysis by identifying that abnormal data. Because if you have to have the knowledge to know if that data is abnormal. In summary, here are some questions. When would you find which type of assessment? Initial, ongoing, focused, or emergency? What's the difference between holistic nursing assessment and a physician assessment or a physical medical assessment? What are the steps of the nursing process? What is the difference between subjective and objective data collection? If you can answer some of these questions and meet your objectives, you are on your way to understanding your Chapter 1 nurse's role. Thank you and have a great day.